Hello, my name is Clare Smith and I'm the Chief Operating Officer at Leeds Teaching Hospitals Trust. This is a short film about the hospital's response to the coronavirus pandemic. It's a story about courage and commitment and the dedication of our staff in every ward and in every department. We're showing it because we believe it's important for people to see how our teams worked incredibly hard to provide care for patients, those with Covid-19 as well as many emergency patients who needed care for other life-threatening conditions. It's a tribute to our teams who worked and who continue to work determinedly and steadfastly to save lives and to protect each other. The pandemic has had a very profound impact on our people. Many people stepped up to the immense challenge we faced as large parts of the hospital were turned over to critical care. At that point, we had little information about how much of this would be needed. Staff retrained to provide care for seriously ill Covid-19 positive patients on respiratory wards and in critical care. Many others worked in new roles to support recruitment, bereavement, staff testing and PPE fit testing. At the same time, partners in the Leeds health and care system worked incredibly well together to manage the onset of the pandemic. From our position as the receiving hospital for Covid-19 patients, we recognise the additional pressure that was placed on our partners in health and social care as we responded to the national guidance to discharge as many patients as we could to maximise capacity for the surge of very sick patients. We saw excellent partnership working and really strong stakeholder relationships across the city and region, thanks to a shared sense of purpose, patient-focused processes and a shared concern to protect our local communities. Within our trust too, some fantastic support networks have been set up between colleagues, really looking after each other. One of the remarkable things that came out of the pandemic was the spontaneous response of people across the UK to the dedication shown by NHS staff. As people joined the NHS clap every Thursday, paying their respects. People also supported our teams by sending cards, bringing in meals and providing gifts. Our chair wrote more than 1,000 thank you letters on behalf of our trust board to acknowledge our gratitude for this flood of support. I know our staff felt appreciated, and it was very fitting they were celebrated as NHS heroes, even if those on the front line did not always feel like that. Providing care throughout the height of the pandemic was hard, and we should all take a moment to recognise the NHS staff nationally who died following a positive coronavirus test. During this period, the NHS certainly lived up to its reputation as a national treasure, and there were thousands of individual examples of great empathy and compassion. Grateful family members who were unable to visit at the height of the pandemic wrote to thank staff who stayed with people as they died, so they were not alone. Staff took time to read letters from family members to loved ones in hospital. In one instance, a married couple in critical care were brought together so that they could be together at the end of their lives. Alongside tragedy and heartbreak, there was also celebration. None more pleasing than those instances where our teams paid tribute to Covid-19 patients by clapping out survivors who'd been very seriously ill and had made remarkable recoveries. Of course, many others did not survive the new disease, leaving family members bereaved and NHS staff still dealing with the impact on them as professionals. In practical terms, a reduction in surgery and consolidation of surgical activity meant we were able to transform non-active operating theatres into critical care areas, creating over 300 critical care beds. Our estates and facilities support teams worked hard to upgrade our infrastructure across some of the ward areas to create additional oxygen storage and flow for this increased number of patients requiring high-level respiratory support. There was huge stress on colleagues working in new environments, and especially those working in critical care, where up to half of the patients being cared for sadly did not survive their illness. Our mortuary staff provided gifts to bereaved families of one of a pair of twin-made hearts sent in by well-wishers, the other heart remaining with patients who had not survived the disease. We saw terrific support from our clinical psychology team, providing help to tired and traumatised staff and providing new and innovative online services and support in the form of therapeutic techniques. We took steps to establish sufficient local supplies of PPE in light of huge national demand and at times limited supply. We worked with partners across the NHS and social care to buy PPE and to manage its flow to the front line when it was needed. And our infection prevention and control team worked incredibly hard to ensure everyone kept as safe as possible and was wearing the right kit. Our clinical teams reviewed and prioritised elective and outpatient waiting lists. This meant we had to follow national instructions to cancel elective surgery unless it was for cancer, life or limb or sight-threatening conditions. And we also had to cancel routine and planned diagnostics. Non-urgent outpatient activity was also cancelled, and we increased the use of non-face-to-face appointments for outpatients, including telephone calls and video teleconferencing. In 4 months, we carried out more than 4,000 virtual consultations across 80 specialty areas. This meant upgrading our technology to provide staff with secure remote access to information and clinical systems so that they could work from home where possible and continue to support our patients. We continued to accept referrals on the Cancer 2-week wait pathway, and these were triaged by our clinical teams into high risk, low risk and uncertain risk. And we found innovative ways to ensure we continue to care for vulnerable patients, including homeless people. In maternity and in cancer, our teams use social media to provide advice and support to expectant mums and patients at home. Our pathology team, which provides a laboratory service for trusts across West Yorkshire, saw a huge increase in demand for testing and worked to increase their capacity from around 300 tests per day to 1,500, whilst maintaining a 24-hour turnaround. Our non-clinical support teams continue to provide a high level of support, either at our hospitals or working from home, overcoming the challenges that this sometimes presents. We were asked to commission and to build the NHS hospital for Yorkshire and Humber at Harrogate, opened by the £25 million fundraising hero Captain Tom. It stands ready to provide almost 500 critical care beds for the region, should we need them. In the event, the facility remained unused for COVID, a success in itself, although we were able to use it to help us with diagnostic CT scanning in the reset and stabilisation phase. We are now in that window of opportunity, aiming to make the most of the time available to treat those patients who are on the waiting list before the onset of winter and the possible resurgence of COVID. We are working hard to do this, and in some areas we are making great progress. For instance, in our cancer treatment, we are back to 80% of our capacity for chemotherapy. However, the numbers of new Covid-19 cases are now starting to rise. Although numbers are still relatively low compared to the peak, they are rising quite quickly. We are seeing new guidance about restrictions on how we live our daily lives, and we are already seeing local lockdowns in response to the outbreaks in parts of West Yorkshire. Our research teams are leading the way to ensure patients have access to the widest possible selection of potential therapies for Covid-19. They are now actively involved in trials to test potential new vaccines to protect against the virus. They recruited the first patient globally and the first patient in the UK to 2 Covid-19 research trials of potential new therapies for the virus. a fantastic achievement at any time, but particularly during such a busy period. We sincerely hope their research will be successful so that we can save lives and strengthen healthcare in Leeds. We were so grateful to the public, to our partners and stakeholders for their support during the first phase of the pandemic, and we know that their support for the NHS will continue as we move through this next phase. But we can be in no doubt that the coronavirus is likely to remain a significant factor in the way we are able to deliver care for the foreseeable future, even after any vaccine is developed. There are undoubtedly big challenges ahead. Our staff needed to work in a way we hope to never see again, but we are proud to say that our values, the Leeds way, helped us navigate our way through a very difficult period. Our challenges are now different, but no less severe, in finding ways to ensure that patients whose care was delayed are seen as quickly as we can manage whilst COVID restrictions are still in place, limiting our capacity and patient flows. We are making careful plans that mean we will be able to continue providing the best care for our patients. We learned a lot about providing services and caring for patients and for each other during the first wave of this pandemic, and as a result, we are in the strongest possible position to take on the challenges we now face.